Today, we will be talking about the differences between giving birth in Norway versus giving birth in the US. Two quick little things. One, I did not give birth in the US. I only gave birth in Norway. So my personal experience is from the Norwegian healthcare system. Now, hopefully I have done enough research to make up for the fact that I haven't experienced giving birth in the US. If there's anything that I missed, please feel free to tell me in the comments below and let me know your story, whether it's from Norway or from the US. I think this stuff is interesting and I love learning about it, so just tell me. Number two, my script is down here, so if I'm looking down here, that's what I'm looking at. But I'm gonna try to keep this as neutral as possible. However, it is inevitable that we will be talking about the shitty US healthcare system. So if you're someone who gets upset by that, don't watch this video because you will get upset. Okay, now we're gonna be breaking down the differences between being pregnant, giving birth, and postnatal care in Norway versus in the US. We're gonna touch on things like how the system works, what the care looks like week to week, how much it costs, and what postpartum life looks like. Quick overview of the health systems in general. In Norway, healthcare is universal. If you're a resident, pregnancy care is covered. Checkups, ultrasounds, hospital birth, the whole thing. You will not get a surprise bill for normal maternity care. In the US, there is no universal coverage. Most people rely on private insurance through a job or just an individual plan, or on Medicaid if you qualify by income or pregnancy. What you pay in the US depends on your insurance coverage, your deductible, and your state. So when I got pregnant, I called my GP, my general practitioner, and I told him that I was pregnant, and things just started happening. I got booked with the midwife, my routine ultrasounds just got scheduled, and the timeline was basically handled for me. That's normal here. That's how it usually begins with every pregnancy. Think of it like school scheduling. Once you're in the system nudges you along. You still make choices, but you don't hunt for your teachers. You don't hunt for your providers. You don't have to call your insurances first. In the US, you usually choose an OBGYN or a midwife. You make and book the first prenatal appointment yourself, and you double check that they are in network for your insurance. You will also have to handle referrals for ultrasounds and lab work. It's doable. Literally, it's done every single day. It just takes more phone calls and knowing your benefits. Now, in both countries, if your pregnancy is low risk, your visits will start out every 4 to 6 weeks, then usually every 2 to 3 weeks, then every week near the end. You'll have blood tests, urine checks, blood pressure checks, and screenings for things like gestational diabetes and anemia. In Norway, most care is going to be midwife-led with GP support. You'll get the big anatomy scan around 18 weeks, and the point is steady check-ins. Not lots of fancy intervention if it's not something that you need. Most care in the US is OBGYN-led, so doctors who specialize in pregnancy and surgery. Midwives do practice in the US, but they attend a minority of births overall. The US has fewer midwives relative to births compared with most countries like Norway. Both are legit. Norway leans let healthy pregnancies stay simple. The US leans specialists run the show, which is great for complications, but sometimes can mean more tests or procedures that you don't necessarily need. So, costs in Norway, it's easy. You wanna know why? Because it's basically zero. Prenatal visits, the standard ultrasounds, you can go to private doctors like to get that, you know, that kind of creepy 3D ultrasound where you can see like your baby's face and stuff. Those kinds of things you do have to pay for, but the basic standard ultrasounds are covered. Labor and delivery in a public hospital, all covered. You won't be hit with separate facility fees, anesthesia bills, or surprise lab charges for routine stuff. Now, in the US, with insurance most people still pay something out of pocket. Recent analysis of big employer plans put the average out-of-pocket cost somewhere between $2,800 and $3,000. Total in-network amounts, so including everything, typically land around the mid-teen thousands for a vaginal birth and closer to $20K for a C-section. But it varies a lot by state. Here is a price breakdown in the US that can be helpful to know. One, you have the facility charges, the hospital or birth center. This is the biggest slice of the pie. Then you have the professional fees, so your OB or midwife, your anesthesiologist, your pediatrician. Then you have your prenatal testing and ultrasounds sprinkled in throughout pregnancy, right? And then you have postpartum care, so visits, lactation, etc. It's often a smaller share of the pie, however, it's still real. Your exact bill, of course, is going to depend on your deductible, your co-pays, your co-insurance, and whether every single person who touches you during the experience is within network. What it looks like on the day. In Norway, most straightforward births happen in hospital maternity wards or midwife-led units, which I'm pretty sure is where I was. That day is a bit of a blur, but I'm pretty sure that's where I was. You'll get pain relief options, nitrous, gas and air, epidurals, whatever else. And to me, a vibe that felt calm but practical. It was very quiet in the hospital. I couldn't hear anybody else. However, everyone was very informative, nice, and straightforward. Typical post-birth hospital stay is somewhere between 1 to 3 days if all goes well, and then it's usually 3 to 4 days if you needed a C-section. A midwife, of course, checks the baby right after birth, and a pediatrician will examine the baby within a few days. In the US, nearly all births are within hospitals with OBs or midwives. Epidurals are common and widely available. If complications pop up, your OB is able to move quickly to assist delivery or provide C-section. C-section rates in the US are about 32% of births are cesarean, and that is according to Sage Journals in 2023. And in Norway, it is lower than the US, aligning with a more midwife-led, low intervention approach for low-risk pregnancies. So in Norway, postpartum support is just baked into the whole pie. You're typically offered a midwife home visit within the first 1 to 3 days after going home, plus a public health nurse, a helsesykepleier. They will come and visit your home within the first 7 to 10 days. Then once you have given birth and once this public health nurse comes and visits your home, you are now in the standard child health program with automatically scheduled checkups for your baby and toddler through age 4. That means all of your vaccine appointments, all of your health checkups they're just scheduled. They just happen. I get a little text on my phone like 2 days before or something that tells me that I have an appointment to go to. It's really that simple. In the US, professional guidelines, ACOG, the American College of Obstetrician and Gynecologists, say you should have contact within 3 weeks and a comprehensive visit by 12 weeks after birth. However, many people miss these appointments due to time, transport, childcare, or insurance issues. What's nice about Norway in this situation is that Norway brings the care to you. Postpartum is stressful and postpartum is emotional. So having to deal with these things, remember these things, schedule these things, it can be hard, difficult, and even more so if you have other children already. So in the US, if you're supposed to come back in, life with a newborn can just make that very difficult. I can remember my 7 to 10 day visit with our public health nurse, and she came into our home. She had like the scale with her, and she weighed our baby, she measured her, all of those things. We were having trouble with the breastfeeding, and I had seen a specialist as well by that point, like a lactation expert at that point, and still it was very difficult. And she came and we talked to her, and she you know, kind of helped us to say like, it's okay to do formula, you know, it's not gonna change anything in the long run. And she was definitely a big part of that decision, which was hard for me. I remember very much focused on me in that appointment. She really wasn't that worried about the baby once she had weighed her, measured her, and, you know, realized that she was fine, right? She was much more worried about me and my health at that time, my mental health at that time. She asked me a lot of questions about postpartum depression, postpartum anxiety, all of those things that can happen after giving birth. And, you know, she made it very, very clear that if anything were to arise, that I needed to contact them right away, which I thought was pretty crazy, that was such a big part of their program. And even, I think it was like 12 weeks, we had another visit with our midwives, and it was kind of the same thing where they, you know, they measured the baby, weighed the baby, all those kinds of things, made sure she was on the right track, but it was mostly focus on me and my health and how I was doing mentally. So I thought that was refreshing and important, truly, because that's something that really is not talked about a lot with women and their health, is postpartum, is women's postpartum mental state. It can get crazy in there afterwards. So it is really refreshing to know that that's a part of the Norwegian system without you having to ask for it. They just do it. Okay, here's a big one. In Norway, parental leave is generous and it is paid. According to Commonwealth Fund and NAV, for children born July 1st, 2024 or later, parents can choose 49 weeks off at 100% pay or 61 weeks at 80% pay. This is split between the parents with a specific quota of weeks reserved for each. This dramatically lowers stress and lets families heal and bond and get to know each other. In the United States, there is no federal paid maternity leave. Many people use the FMLA, which gives up to 12 weeks of unpaid job protected leave if you or your employer meet a certain criteria. Some states have their own paid family leave programs, but it depends on where you live. It depends on who your employer is. To me, outcomes matter. In 2023, the US maternal mortality rate was 18.6 deaths per 100,000 live births, an improvement from the pandemic spike, but still high for a wealthy country, with a much higher risk for Black women. In 2022, Norway's maternal mortality rate was reported as nearly zero. So, why the gap? Experts point to differences in access, so insurance coverage. Really? There are fewer midwives in the US, and you have less guaranteed postpartum support like home visits and paid leave, and broader inequities that hit people of color the hardest. To me, this gap shows that systems in place and social supports affect health greatly. So to me personally, in Norway, it felt like the system moved me along. Appointments were arranged after I said I was pregnant. I never had to argue with the billing department, and my birth was comfortable and quick. That doesn't mean Norway is perfect. From what I understand, staffing can be tight in some places, but the basic structure supports you. Big wins for Norway are it's predictable. There's no bill experience for standard care. It is a midwife-led model. You have early home support and you have paid parental leave that actually lets you recover. The US has strengths as well. You have access to high-tech care and specialists. This is great for high-risk scenarios. You have more birth setting choices. However, some of the challenges can be costs, billing complexity, variable access to midwives and postpartum care, no federal paid leave, and worse average outcomes with major racial inequities. And in the US, you can absolutely have a great, safe experience, but you'll just have to plan harder. Choose your in-network providers early, ask the cost questions, and please line up your postpartum care help. If this helped, hit like and share it with someone who is curious about the differences between prenatal and postnatal care in different countries. And again, my birth experience is Norway only. I haven't given birth in the US, but I hope the data and comparisons help give you a clearer picture. Remember to subscribe if you like this type of content, and I'll see you in the next one. Bye.